For nearly 30 years, Humana has offered Medicare plans to the public. In that time, we've learned a lot about how to be a better partner in health. Our goal is to help our members achieve lifelong well-being. At Humana, we know thinking about Medicare and all your options can be overwhelming. We want to help you understand these options and the plan that you choose. We'll start by looking at when you can enroll. There are specific times when you can enroll, disenroll, or change your Medicare plan. October 15th until December 7th is the annual election period. During the rest of the year, you may qualify for a special election period or SEP if certain special circumstances apply to you. If you've missed regular enrollment, you can speak to your agent about whether you qualify for SEP. Now, let's look at the basics of Medicare's prescription drug coverage, also known as Medicare Part D. This coverage is set up to help members save money on prescription medicines. Medicare prescription drug plans are available only from private insurance companies approved by Medicare. You can still enroll in a Part D plan even if you haven't had prescription drug coverage in the past, but you might pay a penalty for late enrollment. And the longer you wait after you first become eligible, the higher the penalty will be. So how do you get prescription coverage? Option 1. Join a standalone Medicare prescription drug plan like a Humana prescription drug plan, which covers prescription drugs only. Option 2. Join a Medicare Advantage plan or another type of Medicare health plan that covers your doctor and hospital care as well as your prescriptions. If you're already enrolled in a Medicare Advantage plan other than a PFFS plan that does not include Part D coverage, and then you also enroll in a standalone PDP, in most cases you'll automatically be disenrolled from your Medicare Advantage plan. So if you do have a Medicare Advantage plan, you'll want to talk to your agent about your options before taking action on a prescription drug plan. Humana offers 3 standalone Medicare Part D prescription drug plans, PDPs, to help you balance your health needs and budget. Humana Walmart RX Plan, Humana Enhanced RX Plan, Humana Preferred RX Plan. Your Humana sales agent will provide additional information on the specific pharmacies covered by each plan and help determine which plan best fits your needs. They'll also review the specific plan benefits, premiums, and co-payments for the plans in your area. Here's a quick look at how the plans are structured. Different drugs are separated into different drug tiers. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred brand name drugs. Tier 5 is specialty drugs. Generally, the higher the tier, the more expensive the drug. There are a few other things to keep in mind before choosing a prescription drug plan. Be sure to review the formulary or drug list with your agent. This is a list of specific medicines covered by the plan and is available at Humana.com. You need to make sure that the plan you choose covers the drugs you use before you enroll. In addition to brand name drugs, a Humana prescription drug plan may offer generic alternatives, which may offer even greater savings for you. Our prescription drug plans offer a pharmacy network with preferred cost sharing at select pharmacies. That means you pay a lower cost when using pharmacies with these network arrangements. In urban areas of some states, the availability of preferred cost-share pharmacies is limited. These states include Connecticut, Massachusetts, Rhode Island, Vermont, New York, North Carolina, South Carolina, Michigan, Ohio, Missouri, and Mississippi. If you live in an urban area in any of these states, you may still enroll in a Humana prescription drug plan. However, you may pay more if you do not fill your prescriptions at a preferred cost-share pharmacy. Before enrolling, make sure you're able to travel to these pharmacies if you plan to take advantage of lower copays. Talk with your agent about which pharmacies offer preferred cost-sharing. Talk with your agent about the specific drugs your plan covers. You can also look up your prescription drugs and their costs on our website at Humana.com. Even if you see your medicines listed, in some cases Humana may require you to try certain drugs first to treat your condition before we'll cover more expensive drugs. This is called step therapy. Manufacturers must agree with CMS's terms and conditions to contract with Medicare, so not all brand-name drugs may be covered. The Medicare prescription drug coverage gap, or donut hole, is the period when you pay part of your drug costs before additional Medicare coverage kicks in. This year, once you enter the coverage gap, you'll receive discounts on your prescription drugs. You'll be responsible for paying no more than 58% of the cost of many generics and no more than 45% of the cost of many brand-name drugs. People with Medicare who receive a low-income subsidy or are enrolled in an employer-sponsored retiree drug plan, with the exception of employer groups with waivers, won't be eligible for this discount. Okay, we've discussed when to sign up, what your Medicare Part D options are, and the specifics of prescription drug coverage. So, what's next? Your agent will review two very important documents: the Summary of Benefits, which covers many of the specific features of a Humana prescription drug plan, and the formulary or list of drugs covered by this plan. Then, if you choose to sign up for a PDP plan, you'll decide if you'd like to receive your plan coverage documents online or paper copies in the mail. Online is a great way to stay organized and save paper. If you choose our online option, we'll send you an email. You can then go to myhumana.com anytime to get started, learn more about your plan, and view your documents. You'll receive your Humana member ID card in the mail. We've covered a lot of information today, and if you still want to know more, don't hesitate to call us. We're your partner in health and happy to speak with you anytime you have questions. Your Humana licensed sales agent, who's presented your specific plan benefits today, will also be happy to answer any additional questions. Another great resource is the Medicare and You Handbook you should have received in the mail. You can also go to www.medicare.gov, the official Medicare website.